How do you communicate about sexuality and reproductive health topics to your child? Does your child have sufficient sexual and reproductive health knowledge? These are the questions that we will answer in our study by focusing on children with special needs. My name is PADMA RAHMAN. I'm going to present to you a preliminary finding on sexual communication techniques and sexual knowledge among parents with special needs children. Special needs children were known to be exploited involving sexual acts without them being aware of it. Parents play an important role in providing sex and reproductive knowledge to their special needs children, as these children continue to depend on them for supports. As the topic of sexuality is often neglected and taboo to be discussed, this preliminary study used cross-sectional survey conducted in special education classes in primary and secondary schools. Our respondents were parents with special children aged between 8 to 18 years old. We used two standardized questionnaires, which are Parent Sexuality Education Inventory and Sexual Behavior Scale, to answer the objective for this study. 113 respondents participated in this survey, with majority or 80% of them are Malay. The gender of their special needs children were mostly male. Learning difficulties, autism spectrum disorder, and attention deficit hyperactive disorder were found to be most prominent diagnoses of their children. The survey revealed that parental discipline, repeated instruction, and reward system were found to be the most favorable method used by the parents in teaching social rules to the children. Interestingly, parents also reported that their children also relies on internet, drama, or movies in the television to learn about acceptable social rules. Through this survey, it was also found that inappropriate sexual behavior, such as taking off their clothes in public, touching their private parts and opposite gender inappropriately, and masturbate in public were some of the incidents reported by the parents. It was also found that 86% of the children did not receive any formal sexual information, and majority of them in fact does not understand puberty and practicing sexual hygiene. From this study, 90% of the parents reported that they require correct information as they do not have specific technique in educating sexuality topic to their children. The finding of this survey indicates the importance of identifying correct approach in communicating sexuality topics to this unique population. Being cognitively challenged requires the parents to have adequate understanding and approach to deliver the sexual education to their children. With adequate information and sexual knowledge, parents would be more comfortable and better understanding of their own child's sexual behavior. With that, I conclude my presentation. Thank you.